Hello, I'd like to welcome you to A Healthier You. I'm Larry Macon Jr. I'm pastor of Mount Zion Oakwood Village, and I'm also the co-host on the show It's About You on WKYC Channel 3, where weekly I recognize people in our community that are doing great things. However, this web series is about your health, especially during the pandemic. As a leader in the community, I felt compelled to make sure that we get you the latest information in all areas of health. And that's why I'm pleased to be partnering with university hospitals to spread the word in our community about how you can live a healthier life. Today, I'm speaking to Kimberly Canick. She's a certified physician assistant, and she has a master's of science in health sciences. And she works for the University Hospital's Urology Institute. Today's topic is going to be an issue that maybe many of you don't want to talk about, but it affects many lives. So I want Kim to give us our subject for today and introduce what we're going to talk about.
Thank you so much, Pastor Larry. It's great to be here. Today, I thought we would spend a little bit of time talking about urinary incontinence. Okay. It's a big issue that a lot of people face. A lot of people have this issue, this disease. It's actually a disease. It's an issue that we treat a lot here at university hospitals. It's defined as the involuntary loss of bladder control. Okay. With urinary leakage. So this can be just a couple drops of urine, or it could be a full-blown urine leakage, like a full-blown urination. And so it kind of varies between patients. We see that this really affects a lot of Americans, more so females, of course. We know that about 50% of females greater than the age of 65 are affected by incontinence, and for men, about 25% of men are affected by it as well.
Wow, so it affects men and females. I wanted to ask you, though, are there any factors that may increase this challenge that people have?
Yes, there are a lot of contributing factors that we consider. So, of course, number one is advanced age. So as we age, our pelvic floor muscles do tend to become weaker. We see that, of course, females have this issue a little bit more because of our childbearing years. We see that females, more so with vaginal deliveries as opposed to the C-section deliveries, have this higher incidence or increased risk for urinary incontinence. Other things like just chronic diseases, obesity, diabetes, these things also play a role in eventually developing these incontinence symptoms. When we think about obesity, the interesting part about this is that a little bit goes a long way. So if you lose, we consider an obese patient, if they're able to lose maybe 5, 10, 15 pounds, we think about that BMI, that body mass index. If you can change that and bring that down by about 5 points, right off the bat, you can treat your urinary symptoms, and you're seeing 50% less incontinence symptoms just with weight loss alone.
Wow, that's good. Some of the things that you can do to fix it in a moment, but how does this impact a person's life? What are some of the challenges people have when they're dealing with this?
So the way that it impacts people's life, of course, would be, we always want to consider quality of life. Mm-hmm. And so quality of life is kind of top here at university hospitals. Want to make sure that everybody's living their best life. Mm-hmm. A lot of these patients will come into or actually they don't even come into the office. They feel like they might have to just deal with this urinary incontinence for forever. It's just something that they have to live with, that it's just something that happens with age, but this is not the case. It's something that we do treat here. A lot of the times we see that there is this issue with social withdrawal. So our patients who have these incontinence issues might start to stay at home more often, become a little bit homebound. They're afraid to go out in the public for fear that they're going to have an accident, things like this. And ultimately, it can lead to depression. It's a very significant issue. And sometimes we have to treat the depression on top of the incontinence alone. These are kind of your more psychological aspects and implications, but when we think about more physical issues, those exist as well. So things like bed sores, ulcerations, breakdown of tissue from that urine coming in contact with the skin. This is all very, very important things to consider. A lot of the times we see that patients will ultimately end up in assisted living or even a nursing home, long-term care facility, simply because of the incontinence. You want to keep that skin clean to avoid those ulcerations and breakdown of tissue.
Wow.
So it's a big issue.
Wow. Are there different types of incontinence that you could deal with?
There are. So we think mainly about the top four. So there's stress incontinence. So this is kind of when you cough, sneeze, laugh, and you leak urine. And this is with that decreased pelvic floor strength. There's urge incontinence. This is when you get that urgency, and when you got to go, you're rushing to get to the bathroom, and sometimes you don't make it. And then there's what we call mixed incontinence. So this is a combination of both urge incontinence and stress incontinence. And then finally, we have the overflow incontinence. So this kind of generally consider our male patients for this. So when we have a patient with an enlarged prostate gland, this typically has to do with the inability to empty one's bladder. When that prostate gland gets so enlarged that you can't fully empty the bladder, we experience what's called overflow incontinence. And the overflow incontinence actually also is an issue with our neurological disorders. So things like multiple sclerosis, Parkinson's, history of stroke. We see that with these patients, it kind of disrupts the pathway, the neurological pathway between the brain and the bladder, which can lead to incontinence as well.
Wow. So here's the thing I really want to hit on. So how do you treat this problem?
So there's many different treatment options. And of course, a lot of people don't even come to the doctor or to the providers because they think, oh, surgery is the only option.
Right. They're scared.
It's just not the case, right? And you don't need to be scared away. Come on in and come see us because there's plenty of treatments. We'll talk about stress incontinence first. So this is the issue where when you cough, sneeze, laugh, and you leak, typically we would start off with something called pelvic floor physical therapy. So this is not your run-of-the-mill physical therapy. This is done by trained clinicians, specifically trained in the pelvic floor. This is kind of when you think about those Kegel exercises that you may have heard of. So kind of you can do these just at home if you're just sitting watching TV. It's that contraction of the muscle where you pretend like you're trying to hold that urine stream. Hold it, and to start off, you'll only be able to hold it for maybe 1 or 2 seconds, but with time and like any exercise with repetition, you'll be able to hold it a little bit longer. Once you get up to that 5 to 10 second mark, that's great. You want to make sure that you're doing about 20 of these repetitions 3 times a day. So, and then you have to make sure that you're being very compliant and consistent with these exercises, and you want to do this for a couple months. That's when you'll start to feel the difference. So
you can work on it on your own. I mean, that's a great thing. One of the fixes is you can work on it on your own.
Yes, absolutely. And even just with these more conservative measures like this, we're seeing 50% relief of your urinary symptoms right off the bat. So this is terrific. And kind of further down the line, if we think about our stress incontinence, of course, there's the pessary option. So this is reserved for our female patients. Pessary, I did bring some show and tell.
Okay.
We've got a little picture. This is a picture of a pessary. So it's a little rubber kind of piece, a little circle. It can be a little disc. Circle that you just kind of open with the disc. It helps to give support to that pelvic floor. So they are inserted vaginally. Here we can see the anatomy. We've got the bladder here, the uterus here. This is where the pessary kind of sits. And it kind of helps to hold things. It provides a little bit of a speed bump for that urethra so that you're not constantly leaking urine. So that's a great option. It's kind of in place, out of sight, out of mind. You just have to come to the office and have it changed every 3 to 4 months. Make sure that anatomically everything is okay. It's not causing any scarring or abrasions, anything like that. But that's a great option for our female patients. And then, of course, there's always surgery. This is when we start to think about those bladder sling operations or bladder lifts. You may have heard of that term before. We've got our surgeons here that perform the transvaginal tape and the transobturator tape options. So these are just different types of bladder slings. We see great results with this, about 85% relief of urinary incontinence after the 5-year mark. So post-op, after you've had this for 5 years, we're still seeing about 85% relief of these symptoms, which is great.
Wow, 85%. Wow. So there's hope.
There's hope. That's only the stress incontinence. So then if we talk about the urge incontinence too, we've got our wonderful overactive bladder care pathway, and we think about kind of our first line treatments, second line treatments, and third line treatments. So first line treatments, of course, are again more conservative because if we don't have to start a patient on medication, then we'll try to avoid that by all means. Things like just avoiding fluids before you go to bed. 2 hours before bed, shut off all the fluids. Be careful and be mindful of what you're drinking. Things that have caffeine in them, like your coffee, your tea, iced tea, sodas. energy drinks, these all contribute to urinary urgency and frequency and can contribute to incontinence.
Wow, so watch your Gatorade. Watch your
Absolutely.
energy.
Water is the best thing for you. That's what I tell all my patients.
Water is always the winner.
Yeah. Stick with water.
That's great. Now, you have some people that we should see about this at the hospital. Tell us about some of your doctors and specialists that our viewers should watch.
Is it okay? I've got a couple more treatment options too. I'm sorry. There's more. There's even more.
No, pile it on. We need to know this.
So when we think about, that's just the first line treatments with the more conservative measures, watching what you drink and kind of when you drink it. Time voiding is great too. So if you're emptying your bladder every 2 to 3 hours, making sure that you're kind of getting ahead of that bladder, preventing that urgency and incontinence. That's an option. The second line therapies would be things like medication. So this is when we get into our oxybutynin, we get into our Vesicare. I'm sure you've seen the commercials for the
all over the place. Yeah.
The Myrbetriq with the little bladder kind of bouncing around. These are all good options. Know that they do come with their risks. With these medications. We do see the risk for constipation and dry mouth. These are, they happen. It's not with everybody, but it's a potential risk that we watch out for. All we do is treat the constipation, increase your fiber intake, things like that. And generally, patients do really well with it. But if the medication still isn't enough, then we kind of skip to our third line treatments. This would be kind of our Botox injections into the bladder. This provides about 6 to 12 months of relief. So you're only having these injections done maybe 2-3 times a year. You come in and it's, again, we're seeing great results with it. The only kind of side effects or potential side effects, I should say, with the Botox injections would be the potential for you to not be able to empty your bladder and the potential for urinary tract infections, but we monitor you very closely. And then there's another option, which I actually perform here in the office. It's called PTNS, so it's a percutaneous tibial nerve stimulation.
PTNS.
PTNS, yep.
Got it.
This is, I have another picture for you. So this is the tibial nerve that kind of runs along here on the back end of your leg. Yeah. And with a little electrode, a little needle, we place right here, right about here. This is a picture of it actually being done. So this is just a little stimulator, needle gets placed, and we're seeing great results with this as well. So it actually stimulates that nerve that goes up into the bladder. The only cumbersome thing about this treatment would be that you have to come in for 30 minutes a week for 12 weeks consecutively. So it's a little bit cumbersome, but once you get there, once you finish, then you're doing much better and things are going great. Wow. We're seeing about 80% relief of urinary symptoms with the PTNS as well. And then finally, of course, there's always a surgical option. We'll talk about that. So we've got our bladder stimulator. So this is kind of our pacemaker for the bladder. The little pacemaker gets placed over here around the pelvic girdle. And then these little electrodes, these little wires go into the S3 nerve root to stimulate the bladder and help with control. We're seeing, again, great results with this. But, I wanted to let you know that there's so many different options for treatment. Wow. And then this is kind of, we've talked a lot about our female patients, but our male patients too. So our male patients come in with an enlarged prostate gland. I'll go over just the anatomy too of the male GU system, just so we have a good idea. We've got the urinary bladder here, the prostate gland. It's right here in the middle. So this urethra where you urinate out of, it runs right through that prostate gland. We see that individuals that, with age, of course, a men's prostate gland is likely to increase in size and it can get larger. So this is an average prostate gland. So we usually consider the average volume to be about 20 to 25 grams. And then you can get these big honking prostate glands here that do require treatment as well. So for the treatment of the prostate gland, we start with medications again. So your Flomax or your finasteride. The Flomax works at the urethra to help relax the muscle and help you to empty your bladder. And it helps with these symptoms of urgency, frequency, waking up in the middle of the night. And then our finasteride actually works to help shrink the prostate gland itself.
Is there any natural things a person can do to help with the prostate? I know in a lot of communities, the prostate, cancer and things like that is very prevalent. So how can males, especially males, have better prostate health? Better prostate.
So again, we say water, water, water. Just kind of flush that GU system. flush it out, and keep up with your fresh fruits and vegetables. It's all about diet. You are what you eat. So take in those fresh fruits and vegetables. Watch what you're eating. Stay away from the greasy or fried foods, which we all love and taste delicious.
Yeah, it tastes good, but not always as good.
Not good for you. They're not good for you. But as for the treatment options for the prostate gland, we've got our minimally invasive UroLift. So I like to kind of describe this as almost like little implants, little bungee cords that kind of open up this area. So again, this is that enlarged prostate gland. Here we've got these 4 different implants that go in to kind of open up that urethra.
Oh, wow. Okay.
Minimally invasive. It's the same day procedure. You come in, I have it done. It takes about, I'd say 40 minutes or so, and you're out within a couple hours after anesthesia.
Wow.
This, you have a minimal risk of bleeding afterwards, and you usually recover pretty quickly. There's another option. It's called our photosensitive vaporization of the prostate gland. So this is actually going in and kind of shaving off some of this prostatic tissue.
Wow.
In here, taking away to kind of open up that passage again. But again, multiple options. So definitely come and see us. We've got lots of providers here at University Hospital's Urology Institute. Dr. Henderson is here. He is our urogynecologist.
Okay.
And he is here mainly for our female patients. He sees our female patients, and he is our female pelvic floor specialist. And then for our urologists, we've got Dr. Kim Fitzgerald, Dr. Irina Jager, and Dr. Scarberry. They are all urologists, and they will treat both male and female patients. And then, of course, myself, I'm a physician assistant, and then my colleague, John Stout. We both treat both men and female.
That's great. So the hospital is well stocked with the right staff and the right people.
Come on in and see us. Yeah.
To help you out. Even if it's an embarrassing thing, just go in and get it done and get it taken care of so that you can live your best life. I like when you said that earlier.
Absolutely.
It's all about living your best life. But before we go, Kim, can you just give us some hope? Just give some hope to our viewers on their challenges.
Yes, know that there's plenty of options out there. Like we discussed, the treatment options, it's a slew of different options, whether it's the conservative measures, surgery, and kind of runs the gamut in between. Just know that we're here to help you, and we will do our best to take care of you. And that's the most important thing, is just calling, scheduling an appointment and getting in to see us. That's the first step.
Well, I appreciate it, Kimberly, and I want to thank you for expanding our knowledge and sharing with us what University Hospitals is doing to build a healthier you and all of our viewers. And so, again, keep up the good work and keep doing what you're doing.
Thank you so much, Pastor Larry. It was wonderful to be here. I appreciate your time. Be healthy, stay well, and we'll see you next time.
I will do that. And so that's our segment for the week, but keep tuning in on social media as we continue to touch on topics and bring resources to the community. Remember, you can contact me on social media or visit my website at larrymaconjr.com. Or for further information regarding any health concern that you may have, make sure that you contact University Hospitals, schedule a visit, and don't forget, good health is wealth. Again, thanks for watching, and we will see you on our next segment of A Healthier You.